Hi, good morning Perez. My name is Amanda Honey. I'm your invigilator for the OET speaking session on the 23rd of August 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Perez Digo.
And what is your candidate number, please?
My candidate number is 132011720.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What is COVID-19 coronavirus?
The 2019 novel coronavirus, or COVID-19, is a new illness that was first identified in Wuhan, China, in December 2019, with patients reporting cases of fever and acute respiratory illness. Since that time, all the countries have seen cases of the illness and death followed by it.
How is the virus transmitted?
Coronaviruses are a large family of viruses that are common in many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people. Person-to-person spread is believed to occur via respiratory droplets, produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. It may be possible for a person to get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads.
What are the symptoms of COVID-19?
Patients with confirmed COVID-19 infection have reportedly had mild to severe respiratory with symptoms of fever, cough, shortness of breath. Also believes at this time that symptoms of COVID-19 may appear in as few as 2 days, or as long as 14 after exposure.
How can COVID-19 infection be prevented?
The best way to prevent infection is to avoid being exposed to this virus. It is always recommended everyday preventive actions to help prevent the spread of respiratory viruses, including wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces.
In your opinion, who should seek medical treatment for COVID-19?
Patients with fever or acute respiratory illness, who have traveled in the past 14 days to an area affected by COVID-19, or who have had close contact with someone who is under investigation for, or lab confirmed, with COVID-19, should seek medical attention. You should call ahead before going to the doctor or emergency room. Describe your symptoms and identify when you traveled to an affected area.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Hi, good morning, Amanda. I am Perez, your attending nurse. How are you?
Good morning, Perez. I am good. Thank you for asking.
For confirmation, are you here for the review of your treatment?
Yes, I am.
All right. I would like to know about your improvement with eczema.
Sure, my legs are less itchy and sore now. But I am a bit disappointed, the skin on my upper arms hasn't improved.
Good to hear that your condition has been made better than before. Well, gradually the upper arm skin will also improve. Amanda, did you notice any new symptoms?
No, nurse, I haven't noticed any new symptoms, like swelling or blistered skin.
Okay, that's good. Amanda, I wish to know how you have been practicing with the treatment, especially about the use of prescribed Emollient treatment.
Actually, nurse, I have followed the doctor's orders as much as possible.
All right. Well, can you explain in detail, such as how much of the ointment you used, to which all areas, along with the frequency of the practice, so that I can have a better understanding?
Of course, nurse. I have been putting lots of ointment on my arms and legs every night after a long soak in the bath. Besides that, I also have been using a soap substitute to wash my arms several times a day, as I think it will help.
I acknowledge your thoughts. However, you need to avoid excessive washing of legs and arms. When you wash frequently, the skin will lose its moisture, which affects adversely, as the skin will lose its elasticity. This in turn results in the formation of cracks, or other damages to the skin.
Oh, is it?
Yes, Amanda. Wash your body, only if it is necessary to maintain hygiene.
Okay, nurse, I'll take care of it.
Perfect. Now let's discuss the application of Emollient. How to apply the Emollient is that, consider liberal quantities, which will be sufficient to spread across the area.
Okay.
Perhaps, you can apply it a minimum of 3 times daily. The point to be noted is, apply the Emollient immediately after bathing.
Okay, nurse. I have understood the way to apply Emollient.
I'm glad to know that. Well, do I have to address any concerns for you?
Nurse, I had eczema as a child, but I don't understand why it has come back now, and in a different form.
Your concern is quite natural. I will provide the information on this. We will discuss why Xerotic Eczema often occurs later in life.
Yes, you may please.
One of the major reasons behind the condition is the reduced sperm production with aging. For your understanding, sperm is an oily, waxy substance produced by your body. Its function is to coat, moisturize, and protect your skin. It also contains a mixture of sweat, dead skin cells, and tiny particles of pretty much whatever else is in the dust floating around you.
Okay, I got it.
Another reason could be the breakdown of the protective skin barrier, which is the uppermost layer of skin.
All right.
Moreover, dehydration can also be a cause of Xerotic Eczema.
Thank you for your information. It was really helpful. Nurse, I don't want to use the steroid creams. The GP said it would be necessary if my eczema doesn't improve.
May I know why you didn't wish to use the steroid creams?
It is because I have heard they are dangerous and can thin the skin.
I appreciate your consciousness, Amanda. It is true, if the steroid treatment is used for a long time, you may encounter some difficulties. Nevertheless, the steroid cream is safe for a short duration, and is a very effective way to treat your condition. Try not to worry, it will be only prescribed, if necessary.
Okay, nurse.
I will suggest some ways to manage your condition, so that further treatments like steroids can be excluded to an extent.
That will be of great help, nurse.
Other self-help measures include avoiding scratching, which will damage the skin layer. Next, try to increase environmental humidity. Avoid exposure to the dry climate.
Okay, I understand what you have said.
Great. If you feel any difficulties, use antihistamines to reduce irritation.
Okay.
Follow the techniques on the likelihood of improvement with current treatment.
Sure, nurse, I will follow your recommendations.
Thank you for accepting my suggestions. Please feel free for further queries. I wish you a speedy recovery.
Thank you. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.